If you're experiencing shoulder pain in the shoulder joint, maybe that radiates around the shoulder blade, down the arm, up towards the neck, and you've been diagnosed with impingement syndrome or subacromial pain syndrome, I'm going to show you some techniques you can do at home to try to improve your range of motion, reduce your pain, and improve functional use of your upper extremity. Oftentimes our shoulder becomes irritated and inflamed. Sometimes there may be a mechanism where you had a true injury or something that you can really remember that caused everything to kind of start going on. And other times you just woke up one day, it started becoming sore, and then progressively got worse, which limited your range of motion and then your functional use of your upper extremity. The first thing I want to work on is trying to restore range of motion. So what you're going to do with that is you're going to use one of these pieces of PVC pipe. You can use a walking cane or a broom handle. And we're going to say it's my right shoulder that's affected. I'm going to use my left arm to kind of pull my right arm up as high as I can and then back down. And I'm going to do this somewhere between 2 to 3 sets of 10 to 20 repetitions several times a day. Next, we're going to work on shoulder abduction or bringing my arm out to the side. So I'm going to use that same cane and I'm going to push out the side as high as I can go and then back down. As far as hand placement, you can put the end of the cane in your palm. You can hold it like this. It just really depends on whatever feels best to you going out to the side. I'm using my left arm again to do most of the work to bring this up. I'm also trying to use my right arm as much as I can and right shoulder to perform part of that as well. These exercises with a cane are something I would do throughout my program on a daily basis. This is going to be scapular retraction or a banded row. I like to do this with both hands with this to really feel both sides kind of squeeze back. So I have this band fastened over the door. What I'm going to do is pull back and really squeeze my shoulder blades together. So when I come back, I'm really pinching those shoulder blades together. I'm going to go back forwards and then pull back again, really focus on squeezing that area in the middle and upper back. You're going to perform that for 2 to 3 sets of 10 to 15 repetitions. Next, you're going to perform internal rotation. So you're going to use that same band. You're going to bring your elbow kind of in by your side here and have it fastened over by the door. I'm going to bring that in and then back out. Now, I like to start this with my hand in this out position a little more externally rotated versus staying right here neutral. So we're going to start a little bit out and then really pull across. Initially, if that's too painful, you can start just right here next to your body, but I do like to start that ideally in a little bit of external rotation so I have a little more range of motion to work with. You're going to complete that for 2 to 3 sets of 10 to 15 repetitions. Next, we're going to work on external rotation. So you're going to bring your elbow into your side. I like to start this with my hand kind of across in front of my body. I'm going to pull all the way out and then come back this way. And so if this is really painful, you can start just like the internal rotation with a hand in this position and kind of work from there. But if possible, I like to start with my hand already brought in towards my abdomen, pull apart, complete that for 2 to 3 sets, 10 to 15 repetitions. This exercise is going to be a pull down using a band, also known as a standing A. What you're going to do is take the band with both hands. You're going to pull down and back, really squeezing your shoulder blades together. I like to keep my elbows straight for this, have my palms facing down. I'm going to pull that back to really work that middle and lower trap area because that does help with scapular rotation when you're trying to reach overhead. Perform that for 2 to 3 sets of 10 to 15 repetitions. Now you're going to perform shoulder horizontal abduction or band pull aparts. So what you're going to do is take a band and you're going to pull apart the band. As you pull apart the band, you're really squeezing your shoulder blades together. So I'm really squeezing my shoulder blades together and coming back. I'm going to hold that for about 2 to 3 seconds at the end. I'm going to complete that for 2 to 3 sets of 10 to 15 repetitions. The last exercise is going to be standing bicep curls using a band. So I'm just standing on the band here as I curl this up. I'm going to complete that for 2 to 3 sets of 10 to 15 repetitions. We know that the bicep also assists with shoulder flexion and can have some contribution to humeral head decompression, which can be very important when trying to resolve inflammation and irritation around the shoulder joint. Next, we're going to work on thoracic extension using a foam roller. I really like to do this exercise because I feel like that thoracic extension is missing a lot of times when patients have difficulty with reaching overhead. Because when we reach overhead, we do have that extended position or extension of the thoracic spine that contributes, that allows us to reach optimally overhead. So this is a great way using a foam roller in the thoracic spine to really open up all those spinal segments. So what you're going to do is put the foam roller back here on the thoracic spine. You can just vary the position and just lean over that. You can go in different positions with this. It really is up to you. Yeah, I just usually have my patients go in a static position, just leaning back, going in an extension, just applying that stretch and then coming back up. Maybe you hold that somewhere between 10 and 30 seconds, just depending on what your pain level is and how much you can tolerate that. Obviously, if you have some different spinal issues, You want to avoid that, not irritate anything. Next, we're going to look at two stretches that I really like. One is going to be a seated shoulder stretch using a chair. So what you're going to do is grab the bottom of the chair. You can kind of lean away. You can feel that stretch in the shoulder. This is a great distracting stretch, and so it just really feels pretty good to kind of open up that shoulder joint. And I typically have my patients hold this between 10 to 30 seconds and repeat that several times a day. The last stretch is going to be a crossbody shoulder stretch. What you're going to do is bring the affected side across your body. You're going to take a hold of the back of the arm and pull that. I'm going to hold that stretch. You're going to feel that in the back of the shoulder. I'm going to hold that somewhere between 10 to 30 seconds and repeat that several times a day. Thank you so much for watching. I hope this video helps to improve your shoulder pain, range of motion, strength, and return to function of your upper extremity. Make sure and subscribe to my channel so you can get all my upcoming content.